Hello everyone, my name is Robert, student from Nightingale College. This video is going to be a part 2 to my previous video, which is the prenatal education for patient education. I am wearing my school uniform, and as I said, this is just a continuation of the part 2 portion of the prenatal education. I'm going to start off by going over some nutrition and some precautions. For example, with nutrition, I'm going to advise my patient, Mrs. Jones, to avoid certain foods during this pregnancy. She wants to avoid, of course, eating raw meats. She wants to avoid eating raw fish. She wants to avoid eating foods that are high in mercury. That's going to be your tunas. That's going to be your mackerels. That's going to be your swordfish, and in some cases even shark. We want to avoid excessive caffeine. We'll want to definitely avoid junk foods. We want to try to keep that blood pressure under control. So fast foods, we want to try to, avoid that as much as possible. Now, as far as medication, we want to encourage our patient, or encourage Mrs. Jones, our patient, to take her prenatal vitamins. It's essential that she takes those prenatal vitamins. We want to advise Mrs. Jones to avoid over-the-counter medications. Sorry, my camera is shaking. Such as some over-the-counter medications she can take, such as acetaminophen. She can take. We want to, because that should be safe, but at a safe amount, of course. We want to advise Mrs. Jones to stay away from things such as ibuprofen or any type of herbal supplements. Definitely stay away from St. John's Wort. We want to advise Mrs. Jones to stay away from harmful chemicals. This includes secondhand smoke. As far as environmental, right, we want to avoid like lead paints, any type of radiation. Another environmental item that we would like for Mrs. Jones to stay away from, that would be avoid or to minimize contact with cat litter boxes, to avoid from getting the parasite that's known as toxoplasmosis. This is often found in undercooked meats, or usually found in cat feces. If Mrs. Jones does have a cat, we're going to advise her to maybe wear a mask, gloves, and definitely wash her hands after each time. Substances, we want to advise Mrs. Jones to stay away from alcohol, illegal drugs, secondhand smoke, or smoking any type of marijuana or even tobacco products. For travel, it is important that we advise Mrs. Jones not to go to places where there's large outbreaks of malaria or even the Zika virus. That can cause some harm to her fetus. We want to make sure that we advise Mrs. Jones that it's good to travel within her second trimester. Second trimester is a good time to travel. It may be a little bit safer, or most safe, to do the traveling. We want to advise her to bring some form of prenatal records with her. Also, we want to advise her to stay hydrated, no matter what, whether she's traveling or she's not going to travel. Stay hydrated. We want to avoid long periods of inactivity. So, for example, if Mrs. Jones is on a plane or on a bus, we want to even go over some exercise that she can do to keep her circulation good. As far as dental care is very important. Now, when to do dental care would be the second trimester as well, same as travel, second trimester, for her to visit the dentist. A good way to manage pregnancy gingivitis is to do good oral care. Also, we want to be mindful that we inform the patient that good oral care also may affect, or may have a good effect on her pulmonary system as well, so that way she's not inhaling any type of additional bacteria. Also, we want to advise our patient that if she has any questions about anything, that she is to reach out to either her doctor's office or to one of us, and we'll go ahead to make sure that we direct her or advise her in the right way. But also, we want to also provide opportunity for the patient to ask any questions. Right? Thank you very much.